Okay, so what's all the fuss about? Well, a top U.S. vaccine advisory panel, they're called ACIP, just voted to dismantle a recommendation that has been a bedrock of infant health since 1991. We're talking about a major, major shift.
So let's break down exactly what's changing. On the left, you have the old policy, which was super simple. Every single newborn gets the hepatitis B vaccine right after they're born. Universal. But now, on the right, the new recommendation is much more conditional. If the baby's mother tests negative for Hep B, the vaccine gets pushed back for at least 2 months. It's a big shift, right? From this universal shield to a much more targeted wait-and-see approach.
To really get why this is such a big deal, you have to understand the why behind the original policy. And that means we need to talk about just how serious the hepatitis B virus is, especially for the littlest among us, for newborns.
So here's the absolute key thing to understand. It's all about when you get infected. For an adult, hepatitis B might just be a short-term illness. But for a baby, there's a staggering up to 90% chance it becomes a chronic, lifelong infection. And a quarter of those infants will eventually die way too young from things like liver cancer or cirrhosis if they don't get treatment. That devastating risk is the entire reason we started preventing it so early.
And look, this wasn't some flash-in-the-pan idea. It was put in place way back in '91, and it was looked at again and reaffirmed in 2005, and then again in 2018. Each time, experts confirmed it was safe and it worked. So this long history of success makes the 2025 vote to reverse course, well, it's pretty dramatic.
And the results? I mean, just look at this number. 99%. That's the drop in hepatitis B infections in kids and teens since this policy began. It is hard to overstate what an unbelievable public health victory that is. And that's the success story that's now being reevaluated. Which brings us to the million-dollar question, right? If it worked so incredibly well, why in the world would this panel vote to change it? Let's get into the arguments for making this switch.
Well, the people who voted for this change brought up a few key things. First, there's a growing public frustration with vaccine policies in general. And a survey even showed that 16% of parents are already skipping or delaying shots for their kids. They also pointed out that the U.S. is kind of an outlier compared to other developed countries. And some members just felt that the original decision was based on incomplete data.
And this quote from one of the committee members, Retsef Levy, really sums up that whole perspective. In his view, this isn't about undoing success. It's about correcting what he sees as a flawed decision from the very beginning.
But as you can imagine, there was a lot of pushback. Public health experts who want to keep the policy made a powerful case. And it all comes down to this idea of the universal birth dose acting as a crucial safety net. And when it comes to safety, the former head of the CDC, Rochelle Walensky, made this really compelling point. After 35 years and literally millions of doses, our extensive safety monitoring systems have never found a link to any rare, bad outcomes. That's a pretty powerful track record.
And what about that whole argument that we should be more like other countries? Well, opponents say, not so fast. You can't just copy and paste policy. The U.S. healthcare system is fragmented. People lose insurance, they move, they fall through the cracks in ways that just don't happen in places with universal healthcare. So they argue a universal approach is actually more necessary here. And this is what they mean by safety net. It's designed to catch the babies who would otherwise fall through the cracks. And there are 3 main ways that happens. First, sometimes the system just fails. We know a mom is infected, but for whatever reason, the baby doesn't get the care it needs in time. Second, some moms just never get screened at all. And third, and this is a big one, you have screening gaps, where a mom tests negative, but she actually has the virus, either because of a false test or because she got infected after the test. The birth dose protects against all 3 of those scenarios. All right, so we've heard the arguments, we've heard the quotes, but what do the numbers actually say? Let's dig into the data behind all of this.
Okay, get ready for this because this number is just wild. In the U.S., there are about 660,000 people living with chronic Hep B, and half of them, have no idea they're infected. That pretty much blows up the idea that we can rely only on a mother's known status to protect her baby.
And the data also tells a story about who is most at risk. This isn't a disease that affects everyone equally. Almost 3/4 of all infections are in people who weren't born in the U.S., and nearly half are among non-Hispanic Asian persons. So any failure in that safety net is going to hit these specific communities the hardest.
And that leads us to this, the projections of what could happen. Researchers actually model this out. The first bar, that's where we are now, about 625 infant infections a year. The middle bar, that's the proposed change, which could lead to an 8% increase. And if we get even more restrictive, you see that huge jump, a 76% spike. We are literally talking about hundreds of babies getting a preventable, lifelong disease every single year.
So, when you step back, it's pretty clear that this vote isn't just about one shot. It really puts us at a public health crossroads. It's forcing a really tough, really important conversation about how we approach prevention in the modern world. Because what it all boils down to is this one central conflict. On one side, you have this incredibly successful, proven strategy. A 99% success rate is a public health grand slam. But on the other side, you have this very real and growing public skepticism about mandates and a desire for more individual choice.